Lung cancer, the silent killer. Lung cancer occurs when cell growth becomes uncontrollable in lung tissue due to the formation of a malignant tumor. There are three major types of lung cancer. The first is non small cell lung cancer. According to Cancer.org, about 85% of lung cancer is classified as non small cell lung cancer. The next type is small cell lung cancer, which makes up about 10% of all lung cancer diagnoses. This particular type of lung cancer often is very aggressive and more difficult to treat. The final type of lung cancer is diagnosed as a lung carcinoid tumor. Lung carcinoid tumors make up only 5% of all lung cancers. This form of lung cancer generally offers patients the best prognosis because of the slow growth of the tumor. In addition, this type of cancer doesn't spread often. The World Health Organization recently reported that 7.6 million deaths are caused by cancer per year. In addition, lung cancer is the most deadly form of cancer, causing 1,307,000 deaths per year alone. In order to prevent cancer, we ask, what causes lung cancer? The simple answer is that mutation causes uncontrollable cell growth. However, mutation happens for many reasons. One huge contributing risk factor is the inhalation of carcinogens. Carcinogens can cause damage to DNA when inhaled. Medical News Today provides a list of some of the most harmful carcinogens, which include tobacco, asbestos, arsenic, radiation, car exhaust, and more. Tobacco is clearly the carcinogen that is most strongly correlated with lung cancer, since 87% of lung cancers are caused by first or secondhand cigarette smoke. In addition to carcinogens, genetics play a big role in causing lung cancer. Some individuals inherit mutations that predispose them to this form of cancer. Lung cancer is the most deadly form of cancer, and one major reason for this is that the symptoms often only start to appear once a patient has reached an advanced stage of the disease. Some symptoms include a persistent or intense cough, painful coughing, having a hard time breathing and swallowing, being diagnosed with chronic bronchitis or pneumonia, and coughing up blood. Different symptoms often appear when the cancer spreads to other areas, such as the brain. When patients are diagnosed, medical professionals must stage the disease to categorize how much the lung cancer has progressed. Stage 1 occurs when cancer is only in one lung. Stage 2 means the cancer has metastasized to the lymph nodes near that lung. Stage 3A means the cancer has now moved to the lymph nodes surrounding the trachea, chest wall, and diaphragm on the same side as that lung. Stage 3B occurs when the lymph nodes of the other lung or neck have been affected by the cancer. Stage 4 happens when the cancer has moved to other body parts. The primary treatments for lung cancer include surgery, chemotherapy, and radiation. Other developments, such as gene therapy, hormone therapy, and immunotherapy, are currently in progress. Surgery is an effective cancer treatment when the cancer has not yet spread to other parts of the body. Surgeons simply remove the tumor and surrounding tissue. Potential side effects include pain at the surgery area and infection. Radiation treatment works by aiming high energy rays at tumors, which causes damage to cancer cells. Although radiation is effective in killing cancer cells, it also can cause damage to nearby healthy tissue. Common side effects of radiation are fatigue, nausea, and hair loss. Chemotherapy uses chemicals to kill cancer cells by damaging DNA, which impedes cell division. One advantage of chemotherapy is that the medicine works through the entire body and kills cancer cells that have spread. Chemotherapy medicine is often taken intravenously, but there are also pill forms as well. The side effects of chemotherapy are very similar to those of radiation therapy. It is important to note that what treatment a patient will undergo depends on many factors, including the stage of the disease. Many patients undergo a combination of treatment types. Two of the most important behavioral changes that can be made to prevent lung cancer are eliminating alcohol consumption and not smoking cigarettes. It is also important to limit exposure to radon, air pollution, and secondhand smoke. Research has linked HIV infection with a higher risk of developing lung cancer, so always practice safe sex by using condoms to avoid transmission of STDs. Although it is inconclusive whether there is a scientific correlation, following a proper diet and getting regular exercise may also prevent the development of lung cancer.